my name is Şêrwan. I'm health manager in the Kurdish Red Crescent. I'm going to talk very briefly about the operation in south area of Hasake, North Derezzor, since the beginning of the year and the situation now in Al-Hol camp. As the military offensive started in the beginning of the year, we could respond mainly to the health needs for the people, and we were expecting a lot of people to be fled, but not as we saw. So we sent many ambulances, mainly 4 or 5 ambulances from different sites according to the safety and the accessibility that we had that time. But then many other needs rised up, like in the sector of food and in the sector of shelter, mainly because it was too cold. In the beginning and in the front line, our ambulances were responding to the health needs and distributing food in the very front line, and many cases were suffering from cold, some cases of trauma and malnutrition, many cases of malnutrition. In the front line, those teams were making very strict triage and sending the people who are in need to different locations, referring them to Al-Hol camp if the case were in good situation, to be followed up by our primary health care centers and emergency health centers in Al-Hol camp. But if there was more need, we were sending them to other hospitals in Hasake. Those hospitals were supported by WHO, in Şehirlerin Hospital in Tel Tamer and Roj Hospital in serê. The main hospital were responding were in Hasake, and most of the cases at the very beginning were suffering from malnutrition, severe malnutrition, many of them especially children, and cold. So many cases, even before they arrived to our teams, they were already dead, unfortunately. In the second level, we were responding through different maternity mobile units and mobile clinics after the front line, targeting the transitional camps such as in Sor or in other locations like Al-Omar oil field, building up very fast trauma stabilization points or responding to the cases of maternity or something like this. After the arrival of the people to Al-Hol camp, most of the people, and now we have 74,000 people there, another triage were made by our team and other actors also in the camp, to be identified and then referred to the other facilities. In Al-Hol we have 2 primary healthcare centers. We had so far emergency system to refer the cases. The treatment of the malnutrition was difficult because we didn't have specialists to follow all the cases. There are only few people who were following with WHO in Hasake hospitals. In the last part of the people fleeing, the cases have been changed because of the weather getting better, so the cases were suffering more from trauma, not cold as at the beginning. So we saw many cases of shrapnels, injuries like this. Again, another triage were made in Al-Hol after the first triage in the front line. Then the cases were referred again, if there were need, to either to our emergency department in Al-Hol or to the hospitals in Hasake, Tel Tamer and Ras Laim. Right now the situation is more calm, let's say. It's not perfect, but it's better than before. But also there is more services in the camp. For example, KRC has built with many partners an hospital, a field hospital that we are operating now. In this week we finished the blood bank also to be distributed for all the camp or all the facilities in need. Our team were really in helping the people and identifying the cases, those in need. For example, we discovered this week 20 cases of tuberculosis, and one specific case that we discovered very early, and it was very great to discover this very soon. It was leprosy case, which is the first case I think in North Syria. So it was a very great job from the people who discovered it. I mean the community health workers. Now we are having the hospital, and we will expand it in the next few months to have more beds, more services. Also we have the operation desk, which is coordinating for internal referral between the camp from all the facilities, and for the external referral from the camp, from Al-Hol camp, to other hospitals out of Al-Hol if there were need. The other thing that we have to talk about is also the hostages by ISIS in the area of Al-Hol and Baghoz. Until now we are identifying many cases, Yezidîan people, children and women, in coordination with the protection actors, camp administration and the Yezidîan house in Amuda. We take care of them, supporting them psychologically, like to send our protection team to work for them. Also, the people who were in need of health, we were coordinating with the Yezidîan house to refer them or to follow up them in Amuda hospital. We have specialized this for them. In general, and starting from the beginning of the operation, more than 400 people of KRC were involved in those operations, in the front line, in the camp, and also many people volunteered for us, with us in Hasaki National Hospital, doctors, nurses, drivers, to support the needs and the cases those cannot be or need for hospitalization, and due to the huge pressure on the other hospitals in Serê, Tel Tamer and Hasaki.